There are 184 countries in the world divided into 4 different groups according to their income. 30% of all countries belong to high-income group, 14% belong to low-income group, and the rest lay under lower middle income and upper middle income groups. Regardless of the income group a country belongs to, each country has its choice whether it provides public health insurance to everyone, irrespective of their financial background, or whether its citizens need to pay for their medical services as a form of private health insurance. How worth is your health and well-being to your country's government? What if you could not afford your own illness treatment? The doctor said that due to the accident, she got paralyzed and she needs a long-term treatment. Good news are that this treatment is fully covered by the public health insurance. The doctor said that due to the accident, she got paralyzed and she needs an expensive treatment. The treatment is provided by some private health insurances, and it costs approximately $400,000 per surgery and $20,000 per month for the recovery process. And I don't know what I'm going to do to pay for it. She needs the treatment, but it's super expensive. I'm not going to be able to afford it. Same accident, same treatment, different countries. When a country decides that access to health treatments depends on your financial backgrounds, a situation of injustice arises. Sadly, this is the case of 74 countries that belong to both low and lower middle income groups, which is the same as 41% of the total number of countries in the world. We made the research on private and public health expenditure, focusing on 3 main objectives. First, what drives a country to choose to provide public health insurance or not? Maybe the income group they belong to based on their GDP? Second, what have been the trends over the years on private and public health expenditure? And finally, is public health expenditure related to how much percentage of our country's GDP is intended to private health? To answer our first objective, we looked at the data we had and we found out that the higher the income group, the higher the percentage of GDP intended for public health insurance. On the other hand, the results obtained from the other dataset were completely the opposite. The higher the income group, the lower the percentage of GDP intended for private health. To support these statements, we computed the probability of finding a country on each income group with a relative high percentage of GDP intended for public health expenditure and a relative low percentage of GDP intended for private health. As expected, the results showed that it's more likely to choose a country that belongs to high income group and spends more than 6% of its GDP on public health and less than 2% on private health. To answer our second objective, we compared the average percentage of GDP spent on private and public health over the years, and we found out that it has stayed unchanged. Moreover, we observed that on average the percentage of GDP intended for public health was higher than for private. Finally, we plotted a scatter plot to identify the type of relationship between our 2 main variables, private and public health expenditure. It showed that there wasn't any relationship at all between them. To sum up, even though there is no relationship between private and public health expenditure, the higher the income group, the higher the expenditure on public health, and the lower the expenditure on private health.